A 72-year-old retired teacher named Margaret walked into her pharmacy on a Tuesday morning. She'd been taking her medications exactly as prescribed for 8 years. Blood pressure pill at breakfast, diabetes medication at lunch, arthritis pain relief as needed, cholesterol medication at dinner. Her doctors all knew what she was taking. Her pharmacy printed the list on every visit. She thought she was doing everything right. 3 weeks later, she was in my emergency room with kidney function that had dropped by 40%. Not from a disease, not from an infection, from the quiet, invisible interaction happening inside her body every single time she took those medications together. And here's what makes this unbearable. It was completely preventable. The warning was sitting in medical literature for decades, but nobody had the 12-minute appointment time to connect the dots for her. Today, I'm going to show you exactly what those dots are and why, after 60, the rules for medication safety change in ways most doctors don't have time to explain. My name is Dr. Richard Chen. I'm a cardiothoracic surgeon with 28 years in the operating room. I've opened over 2,400 chests in my career. I've held beating hearts in my hands. And I've spent the last decade watching a pattern repeat that should never happen in modern medicine. Preventable kidney damage from medication combinations that looked harmless on paper but became dangerous inside an aging body. The difference between 45 and 65 isn't just more birthdays. It's a fundamental shift in how your kidneys process everything you put into your body. Your kidney function naturally declines about 1% per year after age 40. By 70, you're working with roughly 70% of the filtering capacity you had at 30. That means the safe medication dose you took at 50 might be quietly overwhelming your kidneys at 68. Think of your kidneys like a water filtration system in your home. When the filter is new, it handles everything you throw at it. But as it ages, the same water flow that worked fine for years starts to slow down. The filter gets clogged faster. And if you keep adding the same amount of chemicals to the water without adjusting for that reduced capacity, those chemicals start backing up into the system. That's what happens inside your body after 60 with certain medication combinations. The doses that were safe when you started them 5 years ago are now accumulating in ways that put dangerous stress on kidneys that are already working harder with less capacity. More than 65% of adults over 70 take at least 3 prescription medications daily. And according to research published in the Journal of the American Geriatric Society, nearly 1 in 4 of those combinations carries a risk that most patients never discuss with their doctors. Now, this first medication pairing surprises people every time I bring it up. Number 1, blood pressure medication plus over-the-counter pain relievers. Here's the surprise. The ibuprofen you take for your knee pain and the lisinopril you take for your blood pressure seem completely unrelated. One is for inflammation, one is for cardiovascular protection. But inside your kidneys, they're fighting each other in a way that damages both organs. Your blood pressure medication, whether it's an ACE inhibitor like lisinopril, an ARB like losartan, or a calcium channel blocker like amlodipine, works by relaxing the blood vessels leading into your kidneys. That allows more blood to flow through, which helps maintain healthy kidney function while lowering your overall blood pressure. The increased blood flow is actually protective for your kidneys. It's one of the reasons these medications are often prescribed to people with early kidney disease. Ibuprofen does the opposite. It constricts those same blood vessels as a side effect of reducing inflammation throughout your body. The drug blocks prostaglandins, which are chemicals that cause inflammation, but also help maintain proper blood flow to your kidneys. When you take both medications together, especially after 60, when your kidney function is already declining, you create a metabolic tug-of-war. The blood pressure medication is trying to open the vessels. The ibuprofen is closing them. And your kidneys are caught in the middle, trying to maintain function with inconsistent blood flow. The kidney gets caught in the middle. Blood flow drops. The kidney compensates by retaining more sodium and water to protect itself. That raises your blood pressure, which defeats the purpose of the blood pressure medication in the first place. And over time, this cycle quietly damages the delicate filtering units inside your kidneys called nephrons. Once a nephron is damaged, it doesn't regenerate. I had a patient, a 68-year-old man who'd been managing his blood pressure perfectly for 6 years with an ACE inhibitor. Then he started taking ibuprofen twice a day for arthritis in his hands. Within 4 months, his kidney function had declined enough that I had to adjust his medications. When I asked him if anyone had warned him about the interaction, he looked at me and said, "I bought it over the counter." I thought that meant it was safe. Write that down. Over the counter does not mean safe for everyone. It means available without a prescription. After 60, if you're on blood pressure medication and you need pain relief, ask your doctor about alternatives. Acetaminophen doesn't have the same kidney-constricting effect. Starting tonight, check your medicine cabinet. If you see ibuprofen and you're on blood pressure medication, that's a conversation you need to have tomorrow. Let me ask you something before we go further. How many medications are you taking right now? Not just prescriptions, everything. Vitamins, supplements, over-the-counter sleep aids, pain relievers. Do you know if any of them interact? Most people don't. And that's not your fault. That's a system problem. Number 2. Diabetes medication plus diuretics. Metformin is the most commonly prescribed diabetes medication in the world. Over 120 million people take it. Diuretics, also called water pills, are one of the most common blood pressure treatments for seniors. Hydrochlorothiazide, furosemide, chlorthalidone, these names are on millions of pill bottles. The combination of metformin and a diuretic is so common that many doctors prescribe them together without a second thought. And for most of them, most of the time, it works fine. But after 60, there's a hidden threshold where this combination can shift from helpful to harmful, and it happens quietly. Here's the mechanism. Diuretics make you urinate more frequently. That's how they lower blood pressure, by reducing the volume of fluid in your bloodstream. Less fluid means less pressure against the walls of your arteries. It's simple physics. But when you urinate more, you also lose electrolytes, specifically potassium and magnesium, and you lose more water than your body might signal you to replace through thirst. Metformin, meanwhile, is processed and eliminated almost entirely through your kidneys. Your liver doesn't break it down. Your intestines don't absorb and excrete it. It goes in, does its job lowering blood sugar, and gets filtered out by your kidneys in its active form. That means your kidneys need to be functioning efficiently to clear it from your system. When your kidneys are even mildly dehydrated from diuretic use, metformin starts to accumulate in your system instead of being efficiently cleared out. The accumulation is gradual. You don't feel it day to day, but over weeks and months, the levels creep higher. The result is a condition called lactic acidosis, a dangerous buildup of lactic acid in your blood that can damage your kidneys, your heart, and in severe cases, become life-threatening. The risk amplifies after 60 because your kidneys are already filtering less efficiently. Add even mild dehydration from a diuretic, and you've created the perfect environment for metformin to build up to toxic levels without you feeling a single symptom until it's advanced. A 74-year-old woman came to me after routine blood work showed her kidney function had dropped significantly over 6 months. She was taking metformin for type 2 diabetes and hydrochlorothiazide for blood pressure. Both medications were working. Her blood sugar was stable. Her blood pressure was under control, but her kidneys were silently failing because the combination was overwhelming her body's ability to clear the metformin safely. The question to ask your doctor: write this down. Given my current kidney function, is my metformin dose still safe with the diuretic I'm taking? And should we be monitoring my kidney function more frequently than once a year? That question could be the difference between catching a problem early and facing dialysis. If you're on this combination, make sure you're drinking enough water throughout the day. Not coffee, not soda, water. Your kidneys need hydration to do their job. And if you're experiencing unusual fatigue, muscle weakness, or confusion, those are early warning signs of lactic acidosis. Don't wait for your annual checkup. Call your doctor. Now here's where it gets complicated. 2 more medication pairings after this one. And number 4, that's the one that even I had a significant blind spot about for the first 15 years of my career. Stay with me. Number 3, cholesterol medication plus certain antibiotics. Statins lower your cholesterol by blocking an enzyme in your liver. They're incredibly effective. Millions of people over 60 take them. But certain antibiotics, particularly a class called macrolides, drugs like azithromycin, clarithromycin, and erythromycin, interact with statins in a way that dramatically increases the risk of a condition called rhabdomyolysis. Rhabdomyolysis is the breakdown of muscle tissue. When muscle breaks down, it releases a protein called myoglobin into your bloodstream. Your kidneys have to filter that myoglobin out. But myoglobin is toxic to kidney cells. If too much floods your system at once, it can cause acute kidney failure. The reason this happens is because both statins and macrolide antibiotics are metabolized by the same enzyme system in your liver. When you take them together, they compete for that enzyme's attention. The statin doesn't get broken down efficiently. It accumulates in your bloodstream at higher levels than intended. And those higher levels increase the risk of muscle breakdown. After 60, your liver's enzyme activity slows down naturally. That means the competition between the statin and the antibiotic is even more intense, and the risk of accumulation is higher. Most people have no idea this interaction exists until they start experiencing unexplained muscle pain, dark urine, or extreme fatigue, symptoms of rhabdomyolysis that, if ignored, can lead to permanent kidney damage. I'll call him Robert, a 69-year-old man on atorvastatin for high cholesterol. He developed a sinus infection, and his doctor prescribed azithromycin. A week later, Robert's legs felt so weak he could barely stand. His urine had turned the color of cola. By the time he got to the emergency room, his kidney function had dropped so severely that he required temporary dialysis. The fix here is simple, but requires your vigilance. If you're on a statin and your doctor prescribes an antibiotic, ask this exact question. Is this antibiotic safe to take with my statin, or should we temporarily stop the statin while I'm on the antibiotic? Most doctors will appreciate the question because it shows you're paying attention. And if they're not aware of the interaction, you've just given them critical information. Here's what nobody tells you. You are the only person who sees the complete picture of what's going into your body. Your cardiologist prescribes your statin. Your primary care doctor prescribes the antibiotic. Your pharmacist fills both. But unless you ask, nobody is cross-checking the interaction in real time with your age and kidney function in mind. Which of these medication combinations do you recognize in your own daily routine? Tell me in the comments. I read every single one, because your experience might be the warning someone else needs. Number 4, heartburn medication plus bone health supplements. Proton pump inhibitors. Drugs like omeprazole, esomeprazole, and pantoprazole are among the most commonly prescribed medications for seniors. They reduce stomach acid to treat heartburn and acid reflux. Millions of people take them daily for years without thinking twice. And for most of that time, they work exactly as intended. But here's what I didn't fully understand until late in my career. Long-term use of proton pump inhibitors, especially after 60, interferes with your body's ability to absorb magnesium from food. Magnesium is essential for kidney function, heart rhythm, and muscle health. When your magnesium levels drop too low, your kidneys start to struggle. And if you're also taking calcium and vitamin D supplements for bone health, which many seniors are, you've just created a dangerous imbalance. Calcium needs magnesium to be properly absorbed and utilized by your bones. Without enough magnesium, calcium starts to deposit in places it shouldn't: your arteries, your kidneys, and your soft tissues. That's called vascular calcification when it happens in your blood vessels, and it's a major contributor to kidney damage and heart disease. The medication that's supposed to protect your bones is quietly harming your kidneys because the medication for your heartburn is blocking the nutrient that makes the whole system work. I want to be honest with you for a moment, not as a content creator, as a surgeon. I have stood at an operating table at 3 in the morning, holding a heart that was calcified in ways that should never happen in someone who followed every piece of medical advice they were given. I have spoken to families in waiting rooms at dawn, families who had no idea anything was wrong when they said goodnight 8 hours earlier. In case after case, the contributing factors were not mysterious. They were ordinary combinations. A heartburn pill taken every morning for 10 years. A calcium supplement taken every evening for bone health. A blood pressure medication. A diabetes medication. These are not exotic risk factors. They are the background noise of millions of ordinary kitchens. And that background noise, accumulated night after night, year after year, quietly damages kidneys that were never meant to process that specific combination in a body that's already working with reduced capacity. I want to tell you about a patient. I'll call her Susan. 71 years old, retired nurse, sharp as anyone I've ever met. She came to me after her annual blood work showed kidney function that had declined by 30% in 2 years. She wasn't diabetic. She didn't have high blood pressure that was out of control. But she'd been on a proton pump inhibitor for acid reflux for 12 years and taking calcium with vitamin D every night for osteoporosis prevention. We stopped the PPI and switched her to an H2 blocker, which doesn't block magnesium absorption the same way. We added magnesium glycinate to her evening routine and adjusted the timing of her calcium supplement. 6 months later, her kidney function had stabilized and even improved slightly. The first thing she said to me was, "Why didn't anyone explain this to me 10 years ago?" That question stays with me. It's a big part of why I make videos like this one. Number 5, NSAIDs plus blood thinners, non-steroidal anti-inflammatory drugs. Ibuprofen, naproxen, aspirin at higher doses are pain relievers that millions of seniors use for arthritis, headaches, and general aches. Blood thinners like warfarin, apixaban, and rivaroxaban are prescribed to prevent strokes and blood clots. Both are common. Both are effective when used correctly. But together, especially after 60, they create 2 separate but equally serious risks: bleeding and kidney damage. Here's the mechanism. NSAIDs reduce inflammation by blocking enzymes called QX1 and QX2. But QX1 also plays a protective role in your stomach lining and your kidney blood flow. When you block it, you increase the risk of stomach ulcers and reduce blood flow to your kidneys. Blood thinners, meanwhile, prevent your blood from clotting normally. If an NSAID causes a stomach ulcer and you're on a blood thinner, that ulcer can bleed heavily because your blood can't clot to stop it. The blood loss can be severe enough to require hospitalization. But even if you don't develop an ulcer, The reduced kidney blood flow from the NSAID combined with the stress of processing a blood thinner creates a compounding load on kidneys that are already filtering less efficiently after 60. And here's what makes this particularly dangerous. Many people don't think of aspirin as a blood thinner or ibuprofen as a serious medication because they're available over the counter. But a baby aspirin taken daily for heart protection, plus ibuprofen taken twice a day for knee pain, is enough to significantly increase your bleeding risk and your kidney damage risk, especially if you're over 65. A 76-year-old man I treated had been on warfarin for atrial fibrillation for 5 years. He started taking ibuprofen for lower back pain without telling his cardiologist because he didn't think it mattered. Within 3 weeks, he developed a gastrointestinal bleed severe enough to require a transfusion. His kidney function dropped during the hospitalization and never fully recovered. The fix here costs nothing. Before taking any over-the-counter pain medication, ask your doctor or pharmacist, "I'm on a blood thinner. Is this safe for me to take, or is there a better alternative?" In most cases, acetaminophen is a safer choice for pain relief when you're on anticoagulation therapy. It doesn't have the same bleeding risk or kidney effects. Let me summarize what we've covered today. 5 medication combinations that carry hidden risks after 60. Number 1. Blood pressure medication plus over-the-counter NSAIDs like ibuprofen. They fight each other inside your kidneys and can quietly cause damage. Number 2. Diabetes medication like metformin plus diuretics. Dehydration from the diuretic can cause dangerous accumulation of metformin. Number 3. Cholesterol medication like statins plus macrolide antibiotics. They compete in your liver and increase the risk of muscle breakdown and kidney failure. Number 4. Heartburn medication like proton pump inhibitors plus calcium supplements. Long-term use blocks magnesium absorption and leads to dangerous calcium deposits in your kidneys. Number 5. NSAIDs plus blood thinners. They increase both bleeding risk and kidney damage risk, often without any warning symptoms until it's advanced. Which of these combinations are you taking right now? Tell me in the comments. Be specific, because your story might be exactly what someone else needs to hear before they end up in an emergency room. There is someone in your life, a spouse, a sibling, a friend, who is taking multiple medications and has no idea that some of them don't play well together. Send them this video. That one share might be the most important thing you do today. Every week I bring you honest, evidence-based information that I wish every one of my patients had access to long before they needed surgery. If you want more of that, subscribe. Because the next video is about the 3 blood tests your doctor never orders, but should after 60. Tests that could catch kidney damage, heart disease, and nutrient deficiencies years before they become irreversible. One last thing. And this is important. Everything I've shared today is based on published research and my clinical experience as a cardiothoracic surgeon. But your situation is unique. Your history is individual. Before changing anything, any medication, any supplement, any routine, please talk to your own physician first. That conversation is not a formality. It is the whole point. Better information, better conversations, better outcomes. That's the chain that matters. Your kidneys have been filtering your blood, every drop, every single day for 60, 70, 80 years without ever asking for anything in return. Give them this. Give them the protection of knowing what you're putting into your body and whether those things work together or against each other. It is never too late to ask better questions. Take care of your heart and your kidneys. They've been taking care of you.